Weekend.
Hello there. The first human clinical trials of a Canadian Ebola vaccine begin today in Maryland. Meanwhile, health officials are reviewing the infection control procedures at Texas Health Presbyterian Hospital. They need to understand how a healthcare worker there contracted the Ebola virus from treating Thomas Eric Duncan. The nurse has been identified as Nina Pham, and she's reportedly in isolation at the hospital. The director of the U.S. Centers for Disease Control and Prevention, Thomas Frieden, updated the situation today.
Yesterday, we confirmed the first case of Ebola contracted in the United States in a healthcare worker who cared for who we refer to as the index patient in Dallas, Texas. Our thoughts are with this healthcare worker. She is now being cared for, and we understand that she is clinically stable.
Officials contacted her neighbors and decontaminated the public areas of her apartment complex. The race is now on to identify anyone who may have come in close contact with her. Arise News contributor Akhtar Khan joins us with the very latest. Akhtar.
Thanks very much, Nita B. Well, they said it would never happen and people in the U.S. had nothing to worry about. Well, now we have the first ever case of Ebola contracted on U.S. soil. But despite every possible precaution being taken to combat and prevent the virus from spreading, the questions being asked is what went wrong and why? A small suburb in Dallas, Texas, woke to the news that they may be living in an Ebola-infected area after the news that a Texan nurse who treated Ebola victim Thomas Eric Duncan tested positive for the virus. The nurse was named as Nina Pham. It's still unclear how the 26-year-old healthcare worker contracted the disease, as those treating Duncan say they followed CDC guidelines. But it's believed there was a breach of protocol of those guidelines.
We will double down on training, outreach, education, and assistance throughout the healthcare system, through professional associations, through hospitals, through group organizations and individuals, reaching out to health departments at the state and county levels in cities and elsewhere, so that we can increase the awareness of Ebola and increase the ability to respond rapidly. The team worked hard through the day yesterday, into the night yesterday, and are still actively working today to interview each one of the large number of healthcare workers who might potentially have had contact with the index patient when he was hospitalized.
Investigators are now interviewing and monitoring all staff at the hospital who may have treated Duncan. The president has told federal authorities to take immediate steps to ensure healthcare workers follow protocol. Meanwhile, the nurse's apartment complex has been decontaminated and neighbors notified.
Well, we're going to spray a chemical to help kill, or that will kill everything that it touches.
But this latest case of Ebola has angered some nurses' unions who say hospitals aren't prepared to provide proper guidelines and training to combat the virus.
And we have seen in our hospitals in this country that they have not given us this information. And then when the nurses become infected, they are blamed for not following the protocols.
The CDC say training at the Texas hospital where Duncan was treated has now been ramped up. Now, the hospital has confirmed that the nurse's condition is stable, and the Dallas County judge has confirmed that the nurse, who also owned a King Charles Spaniel, will not be euthanized, unlike the Spanish nurse who also had a dog but was put down as a precaution despite international outcry. Debbie.
Akhtar, what more can you tell us about this Nina Pham?
Well, Nina, family members and friends have spoken to the media about Nina. They've described her as being very compassionate and very caring and a very loving individual. Not at all surprised if she went beyond the call of duty to help someone like Duncan. But they also tell how excited she was that she was going to add a few more credentials to her name. For example, after a Master of Science, now becoming a certified nurse in the intensive care unit. So she, on her Facebook page, put that she was extremely ecstatic about becoming a nurse, and her mother told her that it would be extremely hard work, but she replied, "This is exactly what I want to do." So the community have come out in support of Nina and obviously are holding prayers for her speedy recovery.
Yeah, having support is so important. How has the family reacted to her contracting Ebola?
Well, the family on one side obviously want to be left alone to be able to pray for her speedy recovery, and of course members of saying that consoling the family members, friends, etc. But the other side, some friends and family are extremely annoyed at the emphasis, for example, that she may have slipped up and not followed the protocols or the guidelines set out by the CDC. So on that side, they're infuriated in some respects.
Indeed, Akhtar Khan. Thank you so much, Akhtar. We'll talk to you later.
Thank you.
For expert